the gentleman from Georgia, the pharmacist on our committee. Mr. Carter, your 5 minutes for questions.
Thank you, Madam Chair, and thank all of you for being here. This is extremely important. This is a wave of the future. I started practicing pharmacy back in 1980, and what I've seen in healthcare and the progress that we've made has been nothing short of miraculous. I can only imagine what we're going to see in the next few years, to be quite honest with you, with this type of discoveries that will result from this innovation, and that's exactly what it is. Dr. Hood, I want to ask you, biomarker testing, what does it mean in the context of precision medicine? I heard you say earlier today, and I found it fascinating, being a pharmacist, and I'm thinking of it in terms of from the way that insurance companies now, you have a formulary, and you have to take that medication on that formulary. But what you're talking about, you would be able to identify specific drugs that work for specific patients. And I'm trying to get my arms around how the insurance companies are going to adjust to that, and how we and CMS and Medicare and Medicaid, how we're going to adjust to all that, because it's no longer going to be a competitive bidding system to get your drug on the formulary if it is indeed, as you say, patient-specific and precision medicine like this.
Well, my feeling is it won't be quite patient-specific, but there'll be different categories of patients and smaller categories than they're used to. So blood biomarkers are the most common. The things they can do are, one, I can identify biomarkers that for statins can tell me who can take that successfully and who can avoid the complications of statins, diabetes, muscle pain, and all of the other things. Another use is to be able to see the wellness to disease transition at its earliest stage, and that marker lets us think about therapy at that point in time and a reversal of disease before it ever manifests. And so blood biomarkers can look at any state change, or they can look at populations that respond to external stimuli like drugs. I believe you're going to run into some barriers here, because we run into it now. Let's stick with statins. There are certain statins that work better for patients than others because of the side effect profile or because of the patient's biology, if you will, whatever. But again, I think this is going to be a barrier with coverage. I mean, let's face it, some patients, they have to take whatever the insurance company is going to pay for. They can't afford to pay out of pocket. What other barriers? Well, if in fact the drugs that the insurance companies pay for work every time, then that's going to be an enormous improvement in the long run for better patient response.
Absolutely.
Okay, and again, on the 10 most common drugs, about 10% of the people responded effectively, 90 didn't. So if we can clear those 90 away, we're going to save hundreds of billions of dollars in costs for drugs.
That's good news.
And that's not saying we have to reprice or anything. That's just making sure we match the right drug to the right patient.
Thank you, Dr. Hood. Dr. Abernethy, I want to get to you real quick, and I only have a minute left. We all know what's happening in China, and we all know that the United States has been on the forefront of genomic testing, and it remains the world leader. However, China recently has begun a significant push into genomics and through state-backed entities, and how these companies and the Chinese Communist Party use the data that will become available through genomics research is a major concern with the Intelligence Committee. I have been in hearings here at the Capitol where they have expressed concerns to us about what they're going to do with that. How concerned are you about the threat of China and what we can do to counter China's advances and potential data theft?
Thank you for that very interesting question. Practically speaking, I think we have the opportunity and responsibility to do the critical work, especially in genomics and other areas here in the United States. Practically speaking, the more of that work that gets done outside of our country takes away from our ability to innovate here and also increases risk of, for example, specific information about our population to be in other places where other people can do things.
But do you think it can be used adversely?
I don't have specific knowledge about how it can or cannot be used adversely, but I certainly can imagine ways that genomic information can be used by bad actors when they want to.
Dr. Hood, do you think it could be used adversely?
Well, I would agree with you that the only threat to us in longitudinal phenome and transformation.
Doctor, you need to turn your microphone on, please.
The major threat to us in longitudinal phenome analysis is China. They're the only one, apart from us, that's doing this in a major way. And I think the key is going to be to fund this in an aggressive way so we'll remain a world leader in this particular area.
If they steal it, and they will steal it, they're no friend of ours. And I know I've gone over, and I appreciate your indulgence, Madam Chair. Thank y'all both.